Welcome to We Are Valley, a podcast by Valley Medical Center, located in Renton, Washington. We Are Valley is dedicated to providing you bite-sized advice to improve your health and well-being and keep you updated on the latest medical guidance. This podcast is for informational purposes only and is not intended to be taken as medical advice. So please talk to your provider before making changes that will affect your health.
Hello and welcome to the We Are Valley podcast. My name is Kristen Bidwell and I'm one of the hosts of the podcast, and I'm excited today to welcome Dr. Brandon Teng, one of our gastroenterologists here at Valley. Dr. Teng, would love for you to introduce yourself and tell us a little bit about what you do.
Hi, Kristen. Thanks for having me. I am a gastroenterologist by training. I've been working at Valley Medical Center for about 5 years. I specialize in all different areas within gastroenterology, including colon cancer screening, inflammatory bowel disease, as well as hepatology. So I specialize in a variety of different aspects within our clinic.
Really appreciate you taking time to talk with us today about some really important topics. Let's start with colon cancer screening, because I think it's really important for people to understand why we recommend they come in for their colonoscopies. In the last several years, the screening age has been recommended to start around 45. So can you share a little bit about why we recommend that age at 45 and what that looks like when people are recommended to start their colon cancer screening?
Of course, colonoscopies and stool-based testing for colon cancer screening are important because the goal is to detect cancer at a treatable stage before it becomes incurable. Traditionally, for many years, the age was 50 for colon cancer screening, recommended colon cancer screening for an average risk individual. But recently, it was dropped to 45 due to the increased rates of colon cancer that we're seeing in young adults. And so the goal was to try to increase the detection rates of those colon cancers before they became incurable.
When I turn 45, why is it so important for me to get on your calendar to get that screening colonoscopy?
Yeah, it's a great question. Most of the cancers that we detect all start out asymptomatically, meaning that you may not be experiencing any kind of signs or symptoms of cancer. And the goal is really to detect cancer at that stage so that there is a treatment option that does involve a cure, meaning being able to be completely free of cancer. It's important to get that done because we know as you get older, the incidence of colon cancer rises. And we've shown that by instituting colon cancer screening programs that actually the death rate for colon cancer has actually gone down in the older population. So we know that our screening practices work.
Excellent. I think when people think about scheduling a colonoscopy, there's a little bit of dread.
Yeah, certainly there is.
Yeah, I think, and from what I understand, full disclosure, I haven't had my first colonoscopy yet, but it's the prep work that maybe intimidates people a little bit. So can you talk about, is it really that bad, and what goes into the prep work before they actually get there?
Certainly. I don't think anyone looks forward to the prep part, but we try to make it as easy as possible. And I think a lot of people find it easier than they kind of expected from all the horror stories. The largest and hardest part of the bowel prep is taking the bowel prep solution the night before the procedure. But this is actually, in fact, probably the most important thing that a patient does before the procedure, because getting a good prep for the colonoscopy helps us detect very small lesions that may need to be removed. There are other steps that you need to do prior to a colonoscopy, and this may include changing your diets, avoiding certain medicines up to a week before. And then for certain conditions such as diabetes, you may need to change how your insulin is used, for example. So we do have kind of tailored recommendations, but most people find that the most challenging part is the bowel prep the night before the procedure.
I know that you have these very specific instructions for patients. Do you have any advice to make sure that they follow the preparation so that you're not at risk of having their colonoscopy be rescheduled or, to your point, not as effective?
So I think the biggest problem we see is that sometimes patients just don't read the full instructions until the day before the procedure and don't realize that we ask them to make certain dietary changes before doing the bowel prep solution. And so we ask certain things like avoiding certain vitamins and seeds and having a low fiber diet a week before. We also ask people to not eat solid food the day before, which is perhaps the biggest thing that people forget about. I would say it's most important just to read the instructions that are sent before the day before your procedure.
Yeah, that's great advice. So maybe read it as soon as you get it, and then again a week or so before, so you really know all the things you need to do.
Yep, exactly.
And then ideally your patient has read all the instructions, followed it to the T, gone through all that the night before, and then they show up to get their colonoscopy with you. And what does that day look like for them? And what does it look like for you? What are you looking for?
We work with an excellent group of endoscopy nurses, techs, and staff that try to make the process as comfortable and seamless as possible. Most patients can expect to spend about 2 hours with us total. The process involves getting registered, getting checked in, making sure we go over all your medical details, make sure that we do the consent for the procedure, which is where an endoscopist like myself or one of our other endoscopists would go through the risks and benefits of the procedure. And then you also get a chance to meet our anesthesiologists who will be giving the medicine for the procedure. So most patients are not even aware that the procedure is done because our anesthesiologists do a great job. Afterwards, you recover in a recovery area for about 20 to 30 minutes. And most people go home feeling really great and excited to get a first meal after doing the colonoscopy prep.
Excellent. And then on your end, what are you and your team doing in the procedural room?
Yeah, so in the procedure room itself, in a typical colonoscopy scenario, work with an endoscopy nurse, an anesthesiologist, and an endoscopy tech. And we all have a variety of roles in the room, but of course, number one is patient safety. So we're all there to work and make sure that we do the colonoscopy in the safest way possible. We're all there to keep the patient safe and to monitor blood pressure, heart rate, and vitals, and to make sure that the procedure goes smoothly. Most colonoscopies take somewhere between 15 to 20 minutes, and based on what we do or find, may take a little bit longer. And we all have a different role in making that happen safely. Afterwards, there's a nurse that does the recovery portion. So we make sure that patients recover from anesthesia safely.
Depending on what you find, what do those conversations look like with the patient for follow-up when they wake up, or if there's a need for additional care? What are some of the different things you might find, and then what happens next?
Yeah, it's a great question. So with screening colonoscopies, our main goal is number one, to make sure that we're doing a good look and examination for cancer, but we're also looking for polyps, or what are growths from the lining of the colon. And we know that certain types of polyps can have precancerous changes. And so these polyps can, over a period of years, potentially turn into cancer. And so our goal is to remove every polyp that we find, and our discussions with patients about when their next colonoscopy should be, what is their risk for cancer, is based on family history, and then whether we find precancerous polyps or not.
So will your polyps be biopsied or sent to a lab?
Yeah, so any polyp that we find, we will remove. And I would say over 99% of polyps we're able to remove on that initial examination. All polyps are sent to the lab so we can determine, if they're precancerous or not, and if they're precancerous, whether they have any high-grade precancerous changes, because that will affect when we recommend the next colonoscopy should be.
And I've heard the word polyp a lot in this context, and it sounds to me like you're telling me not all polyps are created equal, and some are perhaps a little bit more concerning than others. So it does sound like then, depending on what type of polyps you have, that will affect how often you have to come for your future colonoscopies.
Yes, that's correct. And I often get questions about, why can't I just do the stool test? Is that as good as a colonoscopy? And I would say that the main difference between a colonoscopy and a stool test is, when we're talking about colon cancer screening, the number one goal is to try to detect colon cancer. But the main advantage for a colonoscopy is that we actually get to find and remove polyps and potentially prevent the development of colon cancer. And so that's the main difference between a stool-based test and colonoscopy, is that prevention in addition to detection.
Right. That's a good segue to one of the questions I had. And I think you're referring to these at-home colon screening tests that people can do from home and send in. And I've heard that if it finds something, you're still going to have a colonoscopy. Is that right?
That is correct. Yeah, so those stool-based kits are made to be highly sensitive and to potentially detect colon cancer. And so you are right. If you have a positive stool test, the road is not over. That means you need to get a colonoscopy sooner rather than later. But we strongly advocate for all types of colon cancer screening, meaning that even though I think that colonoscopy is a better test because you get to both detect colon cancer and prevent colon cancer, doing a stool-based test is definitely better than doing nothing.
Yeah, absolutely. It's at least a step in the right direction. And hopefully they get good results and they don't have to see you. But ideally, then, they are taking care of their health and being proactive, which is always a great thing. You mentioned earlier that often if you find colon cancer or a precancerous polyp, that your patients don't have symptoms, which is part of why you want people to get screened when they're due. What about either before age 45 or in between your screening colonoscopies? Are there symptoms that a patient might come to you with where you would recommend an off-schedule colonoscopy?
Yeah, that's a great question. Even though the screening age was dropped to 45, unfortunately, we still do find cancers in patients who are younger than 45. And most of those patients have come to see us because they are having some type of symptom. And so big red flag symptoms that I get concerned about would be rectal bleeding, significant abdominal pain, unintentional weight loss, change in bowel habits that seem kind of out of the ordinary or out of the blue. And then sometimes we find evidence of cancer on blood tests, for example, anemia or low red blood cell counts that can't be explained. So all those are kind of major red flag symptoms that should be investigated.
And I don't know if we talked about, am I correct that on a regular schedule, you should still be getting a colonoscopy every 10 years once you begin?
Correct. For an average risk individual, you should be having colonoscopies every 10 years, starting at the age of 45. If you don't have any polyps, there are certainly what we would consider high-risk individuals. So people who have a family history of colon polyps or colon cancer should actually potentially start colon cancer screening before the age of 45 and do colonoscopies more frequently.
Good for people to know and take note of that. And you mentioned, unfortunately, seeing colon cancer in younger patients before age 45. Is that something that you've seen increase over the recent years?
Yeah, unfortunately, I think myself and every one of my partners have all diagnosed patients with colon cancer under the age of 45 within the last year. And we certainly see this trend nationally where we're seeing an increased rise in colon cancer for those under 45. So it certainly is not just our experience at Valley Medical Center, but also a nationwide trend.
Yeah, that's really hard to hear about. Do you give any advice to your patients to try to lower their likelihood of later being diagnosed with colon cancer?
I think in addition to doing the recommended screening tests, I think there's lifestyle changes that can be made to reduce your risk of developing colon cancer risk in the future. We know that colon cancer has been tied to heavy tobacco use. It's been tied to heavy alcohol use. It's been tied to obesity. And there definitely seems to be at least a link between colon cancer and diets that are really heavy in red meats or processed foods. We also know that people that have diets that are high in fiber seem to have a decreased risk in colon cancer. And so I think there are certainly lifestyle changes that can be made to decrease your risk of developing colon cancer.
Great. I'm taking notes to look at my lifestyle and try to make some changes. Thank you for that. And I think we've covered colon cancer screening really well. Really appreciate your insight there. I'd love to ask you a few questions just about some of the other things that you see at the GI clinic and in the endoscopy center. One question being, in addition to colonoscopies, your team also does the upper endoscopies. Can you share a little bit about what that's like and why that might be ordered for a patient?
For most of our patients, we're doing upper endoscopies for different types of symptoms. I would say probably the most common reasons would be for issues related to chronic reflux, and then potentially for abdominal pain or problems swallowing. The upper endoscopy is our primary way of evaluating the upper GI tract to try to solve some of these issues. And then there are a variety of patients who are at increased risk to develop esophageal cancer or stomach cancer. who we do regular upper endoscopies for.
A plug for the endoscopy center and the GI clinic staff. I had one and I felt very well cared for. They were so wonderful and made sure I knew everything that was going on. Basically, it's almost like a backwards colonoscopy. Like you go to sleep and they put the camera down through the patient's mouth and check out that side of the GI system.
Yes.
You know, you addressed a few things just for where the upper endoscopy would come in, but my understanding is the GI system is very complicated and there's a lot of different pieces to the puzzle that could be at play. I'm curious if you can share a little bit more about what issues might bring some of your patients to the GI clinic and what those conversations look like as you investigate them with your patients.
The digestive system is quite complex. In addition to what we call the lumen, or the part of your body that digests and processes foods, there's lots of different organs outside of the intestine that assist with digestion and the metabolic functions of the body that we deal with. So this would include the liver, the pancreas, and the gallbladder. And we also deal with a lot of different functions and diseases. So any kind of autoimmune inflammatory disease, liver disease, gallstones, absorption issues, in addition to cancer detection. These are all different reasons why patients would come see us. And so a lot of what we're involved in is, diagnosis in terms of trying to figure out why people are having symptoms and what may be going on. But we also treat a lot of different diseases within the GI clinic. For example, for myself, I treat a lot of Crohn's disease and ulcerative colitis. And so I have a lot of patients that have been seeing me for years to follow their disease. Some of my patients have liver problems that need ongoing monitoring and surveillance or treatment. So there are a lot of different aspects of the digestive system that we treat outside of the endoscopy center.
Wow. I mean, that's a pretty exhaustive list. I'm sure that they probably come to you with a lot of different symptoms that have been bothering them. It's almost like you have to be a detective to try to get to the bottom of it. I feel like this is the sort of thing that someone might start Googling and you might tell them not to rely on Google, but to rely on an actual provider. What does it look like if I come to you with some GI issues and really want to talk it through? What's your process?
Our clinic is staffed by great clinic staff. We take any patient that is willing to come and see us. And typically this involves an initial clinic consultation, meaning that you would come in, we would discuss your problems together, we would review any kind of available studies or previous testing that have been done, and then come up with a further diagnostic or potentially a treatment plan to help our patients feel better and make sure that they get the care that they need.
Fantastic. I'm sure that you have contributed to a much greater quality of life for many people who were at their wits' end in some situation. I think we covered a lot in this conversation. I just wanted to open up to you and ask if there's anything that we didn't talk about that you think people should know about.
So I think we cover this in part, but one of the great things that we offer here at Valley Medical Center is that we offer what's called a direct access colonoscopy program, meaning that if you're otherwise very healthy and don't have any other major medical issues, you can actually directly schedule your colonoscopy with one of our endoscopists. If you have medical problems or other issues or concerns you need to discuss, we do like to see you in clinic, but this is a special program that Valley Medical Center does often to help make the process as smooth as possible for you. Some insurance companies will require a referral from a primary care doctor and some won't, but our direct access colonoscopy team is great and they can help sort out all those issues if you give us a call. And I would also put in a plug. We have one of the best endoscopy staffs in the area. It makes our job really fun and really great to work with such great nurses and techs and anesthesiologists. And so you really get excellent care here at Valley Medical Center.
Absolutely. I can totally vouch for them too. Dr. Tang, thank you so much for your time in this conversation today. Really great advice for so many people that could ultimately be life-saving. And so I really appreciate your time.
Thank you. Of course. Happy to be here for this conversation.
And thank you for listening to the We Are Valley podcast. We will share additional resources in the show notes. And if you'd like to learn more about scheduling a colonoscopy at Valley, we invite you to check out our website at valleymed.org/colonoscopy.
This has been We Are Valley, a podcast produced by Valley Medical Center in Renton, Washington, as a part of our mission to care for our community like family. If you liked this episode, be sure to subscribe to our feed for more great health content. And for more health resources or to find a provider, visit valleymed.org. Thank you for joining us.